Set up 21 years ago, charity Dentaid provide dental equipment and volunteers all over the world to work with in-country dentist partners, supporting their work with people needing help having access to dentistry.
We normally send large equipment, so we're talking about dental surgeries and carry dentist surgeries. So this is small portable surgeries that goes into a box. We normally send one of those at least once a month. When we're sending, we tend to send more than one surgery. So in Moldova, we've sent 3 surgeries worth of X-ray equipment, chairs, sterilisation equipment, which is all kindly donated by dentists over here, and we refurbish and send out.
So far, Dentaid teams have worked in 70 countries, most of them the developing world.
We supply dentists and from the UK as volunteers to work with our dentists overseas to help treat more people, because a dentist overseas might see a school and might go into a school for a day and see 20 people. We can send a whole team over, and it means the whole school is dentally fit by the time we're finished.
Volunteer Clive is a retired dentist and says it's not only developing countries that have a need.
The refugee camps in Greece and in France, and even in this country, there's a tremendous need for basic dentistry, which unfortunately isn't being met.
There's a lot of people who are homeless who really find it hard to go into a normal dental practice. So what we do is we take a mobile surgery to them to help them access their dentistry and provide them with emergency care, which means then hopefully with our care and our education programme that they will then be able to re-access dentistry within the NHS.
A year and a half ago, Dentaid started work in the UK and have a mobile dental surgery they take around the country to help those who are unable to access dentists.
We heard about a lady in Yorkshire who was in such severe dental pain that she pulled out her own teeth. She couldn't get to an emergency clinic. There were no NHS dentists available with appointments in her area to see her, so she took drastic measures. She got an infection and was in real severe pain. We found out that she wasn't alone, that quite a few people were taking sort of drastic measures and this sort of DIY dentistry, which was really, really worrying. And so we started to provide a clinic in that area in Dewsbury in West Yorkshire. It ran for 7 months. People didn't have to pay. We had volunteer dentists providing dental treatment, emergency dental treatment, in an area where there simply wasn't enough provision. If we wanted to sign up for an NHS dentist in that area, there was a 2-year wait. So obviously a lot of people were developing problems. After the success of that project, we had lots of requests from other parts of the country saying there's a similar situation here, and as a response to that, we purchased this Dentaid's mobile dental unit, which means that we can do outreach dental care in places where there's a need. We're really keen to work alongside the NHS, but sometimes people just can't access NHS services, particularly homeless people or vulnerable people, people with a history of mental health problems maybe, so we go to them. One of the problems is they're a little bit sort of out of the system and find it hard to engage with NHS. Maybe they don't have an NHS number, maybe they don't have a fixed abode. So we go to them somewhere they already feel safe and comfortable and trusted. So we go to day centres, we go to shelters, and we drive with our mobile van. We have volunteer dentists who offer free emergency dental care for those people.
Going back to the charity's work abroad, a retired dentist, Volunteer Clive, has been out to Uganda and Rwanda, and what struck him most was how keen patients were to see them, including children running up.
It's not something I'm used to when I was practicing in Wiltshire. They just want to come and see you and want to have treatment, and they're very happy to sit in the chair and let them do what you can to help them. So I think that was a big difference, the enthusiasm of your patients.
Shan Robbins, That's TV.